welcome. This is another episode of HDXWILL's web series. I'm really excited to do this one today. This is really kind of showing you where CBCT can take you, and what we're going to be talking about today is orthodontic analysis. So we're going to go through and again go through a lot of the functions associated with what you can do in an orthodontic realm with a CBCT and with our imaging from HDXWILL. This series will be recorded as usual. So if for some reason you have to leave or if somebody can't attend, we will be releasing that within 24 hours so that our attendees can actually watch the video as well and get this information or keep it to be able to review it as well. Again, please mute your microphone and reduce the noise for the presentation. If there are any specific questions during the presentation, please feel free to send it in the chat room and I will look it up and try to answer those as we go along. With all that out of the way, let's get on to our subject, which is going to be orthodontic analysis. So when we look at orthodontic analysis, traditionally that when we do something like cephalometrics, that you're usually getting a 2D image. And so HDXWILL has versions of our machine that are able, or our CBCT, to be able to do cephalometric imaging. So just to give you an example, I kind of pulled up these to be able to take a look at, and we can see that we have our standard CBCT that's in the smaller classic size, and of course the extended size, which is going to be full face. And then we have two different types of CBCTs in which we have a one-shot CBCT, so just like within a second that image is taken, and a scan ceph, which means it's going to have a moving part that takes anywhere from 4 to 8 seconds to make that scan. But we have different models to be able to do that. Now, when we do it traditionally, when you have a cephalometric image, a cephalometric image usually comes up as a 2D image. So to give you an example of that, it would be something similar to this right here. This is an example of our scan ceph, in which you get a 2D image. With that 2D image, what you're able to get is you're able to see the overlap of the bone. You're able to see the bony prominences to be able to start making your marks. There's also a gauge here so that you're able to get a scale for size when you're doing your measurements, when you're doing the measurements by hand or with a item like a 2D software. Now HDXWILL provides a 2D software that is available, and it's called WILL, and it has some great functions. We're not going to get into that in this particular web series today, but it may be a source of information for future web series to be able to use that 2D software to make this analysis. But today we're going to be talking about our 3D imaging and our 3D evaluation by doing cephalometrics through the 3D image itself. So as we go through, there's a lot of different things we can do with CBCT imaging and being able to find our points and do the cephalometric analysis. So as you look off to the left-hand side here, we have a number of things we can do. So it comes with our software comes the 3D ceph analysis, and we're going to go through that. But even in the beginning, when we went back to DVR in our implant planning section, that when we did that we were able to go through and do some analyzation. But you can see up here, this is for maybe like implant planning, that type of thing. We had our dental, our verification, we can even make a pano. But now we can go into looking at this orthodontic tab here, and we're going to work with that a little bit more today. So again, in our DVR mode, the thing that we like to do at first is be able to kind of take a look and make sure that we can see our image correctly and do our make our pano. So how we do that, always go to Axis Reslice, and let's take a look at our patient positioning. This will give us a scout so we can see the head wasn't turned left or right, and then we can see that all we need to do is maybe adjust the occlusal line to where it's a little bit more flat with the plane. Click OK. Patient's head is now tilted up correctly, and then we can go ahead and move down our line to be able to get right around in this area in the mandible, and then be able to do our arch curve. And I like to do auto arch and spread that out. Now, something you may notice a little bit differently about my pano is that I've expanded it to be able to see more of the sinuses. In your preference model here, you can click on preference and go through to settings, and you can change that panorama height. So when I do a panorama, I like to include my sinuses a little bit more like a standard panorama. And so I've included mine up to 12 centimeters as opposed to the usual height, which is, it defaults to 90. So if you want to make it to where you can see more of the sinuses, this gives you that ability to change that. So again, what we can see here is we can see our patient, and we can see the full pano in here, and we can from that generate that panorama, as we talked about before, to be able to have this image here. So I can take that filter, make it a little sharper, and now we've got a pretty decent pano out of a CBCT. As we described before, 2D panos are going to be inherently clear, but again, if you're manifesting a panorama from a CBCT, this is a pretty clear pano to be able to do so. I'll blow it up so we can all see it a little bit better. Now, one of the things we can also do in pano is as we look through here, we can see this in X-ray form, but we also have other ways of being able to see this. And this is going to become even more important when we go into the orthodontic realm, is being able to look at this one here in the MIP version, and I'll blow this up so we can see it. This just gives you a little bit different reference as to the teeth, where they are inside the bone structure as well. So again, just lots of things that we can do differently. As you can see in this, the fluid levels associated with this are not going to be as evident. So if you go to our pano, then you can see that on the right sinus here, or the left sinus, excuse me, that you can see some fluid levels in here, and it's not going to be as evident in the other view. But just to give you some ideas as to how you can generate different views of panorama for the views that you need. So now, as we go into here, once we've done that arch curve, once we've made that pano here, we're going to go to our orthodontic tab. So what I'm going to do is I'm just going to go ahead and start picking some points to begin with. So move this out of the way here. And so now we have right here, so we can actually see the teeth. We're going to just go ahead and start making an arch curve. So what this does for me is that in the orthodontic tab, that what we can do is we can pick teeth that are analogous right to left, try to slice them through in the middle, double click to get through, and we're going to kind of keep doing that for a couple of teeth here. And what we're going to do is this will allow us to be able to view the teeth in occlusion individually. So we have 2, 3. I'll do one more. So we have that there. Now what that allows us to do is that we can see each one of those lines to be able to see that arch just with those teeth and how they interact. So in this case, I'll go ahead and blow these up so we can see it a little bit better. And you can see that now we can see how each individual tooth bilaterally interacts in occlusion. So we can be able to make an analysis as to if there's some place that doesn't occlude as well as others, or how it occludes bilaterally, that we could actually start to make this analysis. Now, right now, it only shows us 4 different images. If I wanted to do the whole version of that, then all I need to do is change this view to be able to see more views, to be able to make those cuts. Of course, obviously, I'm going to need to make these a little bit smaller as the mouth gets bigger. But again, the idea is you could do the whole mouth. So in this case, I could go back to arch curve, do some more teeth here. And it's going to keep moving those so we can start to see them occlude all the way through. And so it gives you, again, some nice tools to be able to not only look at it, but to be able to slice it through at each level of teeth bilaterally, to be able to see how they interact all the way through the mouth as well. So it's just a nice tool to be able to give yourself one more way of which to make that analysis on their occlusion and how those two teeth interact. So now once we get back over there, so this is our orthodontic tab. So now we're back over to dental again. And again, this is our planning software, so we can go through and again make those arch curves, spread it out, make the pano. But then we can move into the other tab that we're here to talk about today, which is the 3D Ceph tab. Now, the 3D Ceph tab is extremely interesting because this really gives you an opportunity to be able to make your cephalometric markings on a 3D image. Some of the benefits of that are that when you do it on a 2D image, you are only doing it on a 2D image, which means that, say you pick a point like in the sella turcica, that when you pick that sella turcica point, that sella turcica point is a point in space only in 2 dimensions. which means that as the world starts to evolve and understand the 3D evaluation of orthodontics, that you're going to be able to see that now we're going to find out that where in that cell-turcica do we want to be? Do we want to be in the middle of the saddle, off to the side? It just helps to where we're going to be able to start making even more critical measurements and more accurate measurements because we can see it in 3 dimensions. So here we are in our 3D tab. This is our patient here. And so there's a lot of things we can do with this to be able to make some interesting advances. So when we first want to do this, first thing we want to do is orient the patient. So again, since the CBCT isn't taken with the head holders and the measurement, then we want to orient the patient's head to make sure that we're in the right position. So we go up on this tab to mode, we go to Reorient A, and we're just going to click on that. It's going to ask us some quick questions. We're just to say okay. And we're going to ask for the points. Now, when you're doing cephalometric markings normally on a 2-dimensional image, that you would have those points to be able to work with. So in this case, this is the N for the nason, and you can see the software actually gives you a description of where it's supposed to be. Now, in normal 2-dimensional imaging, you may take the nason as the curvature right here, but really it is the V-notch of the frontal and nasal bones, which is very hard to see on a 2-dimensional image. So if we take that around and be able to see this, we can actually see that instead of that point being here, that point is actually right here at the V-notch. And so now we can go ahead and click on that point, and then we're going to move on to the next one. So this would be our cursor to move on to the next, and we're going to click. Now, one of the nice things you can also see is as I move my arrow around, that we're getting on this little right-hand side here, we're getting that microscope. So that gives us an even closer view of where we are so we can see where we're going. And then we're going to go ahead and click. We're going to go for the left orbital. Again, to give you orientation, this is right side, so this would be left side. Your orbital is the most inferior point of the orbital contour, so we're just going to the most inferior point, and we'll click on it. Move to the right orbital. And then the porion, which is which is the superior point of the ear hole, essentially. So we're right here, and we're going to click on that. Again, our microscope shows us. We're going to click on that as well. And then we're going to say, okay, we have our points, and they're just going to orient off of those points to get the head in the right position, right, left, up, and down. And then from that orientation, then this allows us to be able to start picking out the rest of our points with looking at the cell-turcica and being able to look in here. Now we're able to see, you can see that it's there. And we can see in the microscope how clear the cell-turcica comes out and how we're able to have that available to us. And so we can walk through all the different points, and we'll talk about that in a second. But there's a lot of points to be able to pick out. You can customize those points, and within the software, it's customizable so that if you have a standard set of points that you're used to using, that it can be customized where that it'll take you through that sequence of those points. But you can see in this case, it's actually sliced the head open right through the middle so you can get right to the cell-turcica, and then you can click on it. So now you've made that point. And so we can keep going on and on with being able to make sure that we can do that. Now, one of the nice things we can also do is we can click on this right here. And what this does for us is this shows us the actual slices where that point is being chosen. So what's nice about that is that we actually can see in the cell-turcica that we're almost in the center, and we can actually move that point to about right there in the center of the cell-turcica. And now we have, again, much more accuracy as opposed to just on a 2D image. Now we can actually center it in 3 dimensions to be able to make that change and make that much more accurate as well. So again, you can also go back, and we have, thankfully, the undo and redo models. So if you go through it, you put something in the wrong place or you clicked in the wrong area, you can certainly have an undo, redo within there as well. So with that in mind, I'm going to kind of fast forward a little bit, but I'm going to show you something else that you can do. And this is not only for orthodontics, but this is also for pretty much anybody that has one of the CBCTs with our software to be able to do something which I like to do, which in my day, I was a PA in orthopedics. And so I was a clinician. And what I felt was easy is if I could create a story that my patient would understand, it makes it a whole lot easier for my treatment plan to come through. So looking at our image here, that we have this image and it's a skeleton. Somebody can maybe recognize that, but let's make it more personal. Let's make it to where the patient really feels as though they're learning a story about themselves. So what we can do is we can actually superimpose the patient's photo over the image itself. So I clicked on photo, and then what we're going to do is I'm just going to bring this up to where I only want just the front of the face to be able to be seen. So I'm only going to choose about this much. Now you can see that in this area here that I can click on this little bit, and that's going to fill in that. The picture is going to wrap around whatever this purple space is. So I'm just trying to find a space in between that fills up those spots fairly well. And so that looks like a pretty solid line for where the soft tissue lines are going to be. So then I'm going to ask it to generate an image with that. What it's going to do is it's going to create a surface image that we can match the photo to. And here's what the image looks like in the end, where we have the patient's face that the CBCT is generated as a soft tissue image here. So now in our next, we're going to go ahead and load the patient's photograph. So in this case, we're going to take the patient's photograph, and then it's going to ask us to take these dots and put them over the patient's pupils. So this is just, again, orientating the image, knowing where the patient is, upside down, right side up. So they have them right in the middle. We're going to go to next. And now it's time to match the photo to the 3D generated image. So what we like to do is we like to find facial features that are easy to identify. So in this case, the corner of the eye is usually fairly easy to identify. So I'm going to go corner of the eye here, and I'll click on it. I'm going to go over to the 3D model, about in the same area, corner of the eye, and they'll correspond those points together. Again, the other corner of the eye and the other corner of the eye. And we're going to go to the corner of the mouth, corner of the mouth, corner of the mouth. And you have to have 4 points to really get yourself a true alignment of the image as well. You can do more points, but at least 4 corner points somewhere along in the image. Once that's done, we're going to click next. And now the patient's image is wrapped around the CBCT. So you can see now it's wrapped around the CBCT. So when we click OK, then when we go back, now we have our patient's image up here. And we can change it to where what I would like to do is start off with a story saying, here, this is you. And now we're going to go ahead and break apart and start to see what your skeleton looks like the inside and do our evaluation. So we can slowly start to bring that pane down until they can see their skeleton underneath. So it's just one more way in which to do that and be able to bring that personalization to a description of their CBCT and of their treatment plan to be able to superimpose their photo. So I know a lot of, especially orthodontic offices, spend the time that when the patient comes in for their chart records can take a picture of the patient when they come in. Now we have a way to be able to integrate that into our CBCT and again, help that story to be complete. In the case of actually doing orthodontic evaluations, this also gives us the ability to be able to have those soft tissue borders that much more evident to us. So we can be able to make points if we need to, but moreover, it's just easier to be able to see and personalize for the patient as well. So now I'm going to kind of take down the photo a little bit. So now we have a number of things that we can do in the 3D orthodontic realm here. So we can do a chart. The chart, again, allows us to be able to look at some of the points. Dr. Cho is one of the foremost experts on 3D analysis of cephalometrics. And so they actually include his analysis within here, and it allows you to be able to have these points to be able to look at. If you study Dr. Cho's analysis, this will give you the ability to have those as well. It also gives you coordinates to the landmarks that you've chosen. So I've only chosen a couple. But again, it gives you that ability to have that. And then we can be able to go through and then again, we can do a list of the points that are there. We can have measurements between them. And again, that pulls up that same chart. And then here's our photo. We can also make X-rays. So once we have that orientation done, that we can create two-dimensional X-rays. So especially in offices that either don't have the space or are evolving into 3D but still use some 2D images, there's two different ways in which we can create 2D images out of our CBCT. So quickly, real quick, the most common way is to use the Xray generator. We'll use the Xray generator. What that does is this allows us to see the image, and then you can create a lateral film off of that image. Now, this is our basically our version of a 2D image off of a CBCT image. Much like the panel that we talked about before, this is something to where you're going to get layers and layers of overlap. And so that's where you're going to get kind of that blur associated with that. The nice thing about this, though, is that say you don't have complete overlap. So you can see the mandibles aren't completely overlapping, then we can actually take this and adjust this slightly to be able to get us to where we can get a better image with better overlap. So now when I do the lateral again, then now we can create our 2D image. We can manipulate that so we can create a better 2D image for Ceph analysis if we wanted to do so. So that's one way in which we can do that. Going back to our 3D Ceph tab, we have another way in which we can do this, and that is to be able to go in and make an X-ray. So when we make an X-ray, it's going to ask us for which ones we want. So in this case, we'll start off with a lateral. And now it gives us this image. So now you can't adjust the angulation or the tilt of the head, but I can tell you that at least in looking at these images that, that I can see these much clearer. So this would be much more patient position determinant to make sure the patient's head wasn't tilted and or rotated to get less overlap, but you can get a much clearer film through the 3D Ceph portal and being able to create that as well. So just some different things you can work with to be able to create 2D images. What's nice about that, again, going through that we can go through and go back, making an X-ray again. What's nice about that is if you are in such an area that you're going to be doing like an SMV, that normally positioning a patient for an SMV is usually fairly difficult because the patient's already there. We've taken it from 360 degrees, that we can easily create an SMV image off the CBCT. So if some of your vital points that you're using are SMV, then again, now it's able to position the patient in an SMV fairly easily for you because we've already taken the image and now it's just remanipulating the image in the angulation that you'd like. So with this in mind, we're going to actually, I'm not going to go through all the points, but thankfully my education staff is amazing and they did it for me. And so we're going to look at one that's already got all the points in place. As this loads up, that we now have the superimposed picture again, but now we have all the different points that we're going through. Now you can see this may be a lot more points than most people are used to doing. Here's the lateral portion of that, so you can see all the points plotted out. And so again, you can adjust how many of those points that you need to create your analysis and be able to do that. Now, another thing that our wonderful education staff has created is that they've been nice enough to create 3D Ceph Landmarks PowerPoint. This allows us, and this is available to you and to our customers, so that you can actually have something as a reference. So as you go through, instead of having to look up if you're not familiar with some of those points, there's actually a reference to be able to walk through each of those points and be able to define those for you and to work through there. So again, this is available through our education department. And as I've said in every one of these lectures, is that they are wonderful and they're there for your help. And so feel free to call the 1-800 number, ask for education, because they'll be able to reach out to you and work with you to be able to help get these points down, do some education, work with you on getting these orthodontic analysis down, especially in 3D, to be able to work through there. And these are great items to be able to have so that you can use as a reference as well. So again, with here, now we have a patient again that you're able to see all the different points picked out for me, thank goodness. And one thing that you may have noticed me doing along the way is getting the view direction. So again, normally it sits looking anterior, but this allows me to quickly move to different areas and different angles. So if I want to look at a particular angle, that this just makes it a whole lot easier for me to walk through and be able to orient the patient the way I need to see what I want to see. So now going back, we've picked out all these points. And again, if we went through and we wanted to look at the chart, now Dr. Cho's analysis is filled with all the different points, looking at the degrees, being able to go through all the different things that Dr. Cho has chosen are valuable points associated with their analysis on 3D. So you have that available to you. You can export that and print it out in a Word document or a Notepad document to be able to have these measurements and these angles ready to go and already analyzed for you. Again, if you go to landmark, this is just giving you the coordinate planes of where that is. But one nice thing you can also do is that when we go into making an X-ray, what we can do is we can go into make an X-ray. Let's go to the lateral and take that lateral and click OK. And as we go into the lateral, you can see that now here's our tracings that have already been put into place. And so you can actually show the landmarks, and you'll have all the landmarks come up. You can actually click on them to be able to see. You can take this image at this point and be able to capture it to put it into WillMaster, our database program. So you can click capture, and you just click on the image itself, and it keeps the image for you. And so that way you have the analysis lines and you have all the data points associated with it. Again, you can do show hide. You can hide those landmarks too, just so that you have the tracing in front. That when you go to 2D chart, that this is going to give you the 2D measurements under different analysis. So our 2D analysis is going to give you Cogs, Downs, Jerabek, Kim, McNamara, Ricketts, and Steiner. So again, if you were to click on Ricketts, this is going to give you the Ricketts analysis of those same things. So again, it works to be able to, once you pick out your points, you can walk through these and be able to get that 2D analysis. Again, export that analysis for your own benefit and your treatment plan. But you're able to go through that all with the analysis, all doing this off of the CBCT. So you don't have to have that Ceph arm if you don't want to, because you can start moving into the realm of being able to have it that you can do it all through the CBCT as well. And then again, you can export those images. You can clip them. So in this case, when you export here, I've put a file name down of these right here. Actually, I'm going to cancel this for a second. I'm going to show the landmarks. And then when I export, that I'll export it as Xray in this case. And when I save it, that not only does it save the image, but it will also save, let's go to, and now not only do you have the X-ray that we've created, but then we also have, I'll just open it in WordPad, that these will be all the different analysis points along the way. So again, you have the ability to be able to take this out. It may come out better in Word, but the idea being is that you can record those, and immediately when you export it, you're not only going to have the image, but you're also going to have the ability to have all these points, not only in coordinate planes, but be able to get the angles and everything else of that nature. When we go into settings, what's nice is, as we said before, you can choose points that are what you're used to choosing. So in this case, we can choose what 2D landmarks we want to do. And you can choose the ones you're normally used to making plot points about and being able to work through it in the 2D model. So again, in this case, we can choose which ones we think are significant and then make it that way. Our 2D reference, again, we can go and look through and we can look for the different reference points that we want to be able to do. We can change those, add, remove, import, or export if there's other types of analysis you're used to doing. On the 2D analysis, again, you start to see all the points that are associated with the COGS. And if you were to look at, say, our Ricketts again, since we just opened it, we're going to be able to see all these as well. So again, this gives us all the different things and the type of analysis that we want to do. If we want to remove any of those pieces, change them in any way, we certainly can. And then we can also do the upper profile, and this is where we're going to get these points that will make it, and the lower profile and the upper profile to be able to do that as well. But it gives you the ability to modify how you're going and customize how you're going to make the 2D image in your 2D analysis. So it gives you a lot of different features to be able to pull that all together and make it to where you can customize this so that maybe you don't want to do all the points, or maybe you don't need all the points for the type of orthodontics that you're trying to do, that this gives you the ability to now change it and manipulate it and make it to where this can be more customized to your practice. So now we've gone through a lot of these pieces with the 3D stuff and what we can do. So I'm just going to kind of come back here a little bit. And in one of our future WebExes, we're going to talk about TMJ analysis. And again, with the orthodontic, we can also do bilateral TMJ analysis. We can do unilateral TMJ analysis. So again, it gives us a lot of different tools in which we can do things. We can take our little measure and be able to say, okay, well, now that I have this, I'm going to take, and if you want to do a manual measurement, that you could take your ruler, and now on this image, you can go, I want to go from here to here. And now you're able to get individual measurements if you want to off the 3D image or off of a 2D image. So again, all those tools are still available to you, but that this now moves you into the three-dimensional realm of looking at the skull, looking at the dentition, looking at the occlusion, and being able to do this. Now, I think it's important to also add that when you do, if you're doing a CBCT for orthodontic evaluation, that in the positioning of the patient, normally when you're used to doing a CBCT, you have them on the chin rest and you have them with the bite block in place. Well, obviously, if you have a bite block in place, that you're now changing the occlusion because you're spreading it open. So we have an edentulous cup that we can put in that allows us to be able to have the patient in occlusion without anything in between the teeth. So in this case, if I were to turn this patient's head sideways, you can see this little edentulous cup sitting here is part of this image. But this is where the chin rests, so that again, you're able to get all the points, but you're able to get it under occlusion because there is no bite block in the way. This puts you in the field of plane and allows you to be able to get a CBCT in there. But again, it allows it to where you can do it in occlusion as well. So again, some of the other things that we have available, as we said before, is that we could do 2D cephalometrics. And as I said before, we also have software associated with that. I think that it's probably better to be able to do the 2D analysis software on another WebEx. But again, if you have the 2D software analysis from us and you have a Ceph arm, please feel free to reach out to our education team. They've been wonderful enough to create a PowerPoint as well on the 2D analysis so that you're able to understand the points as well as being able to the function of the 2D. And again, we can also do some training on that so that you can get more and more function out of the 2D analysis as well. So I'll move this back over here to anterior. Now I went through that seemingly kind of quick. There's a lot of different pieces to there. And so I want to make sure that if there's anybody, in the chat room, that this is the time to start asking questions. I want to know if anybody's got any questions associated with what we've talked about, because we've gone through a number of different things to be able to look at these. I skipped a lot of the point picking. I figured that would be a whole hour to be able to go through and just have me walk through very slowly how to do each one of the points. I think it's better instead to say that the education team is available to you, so that if you have questions, we have that PowerPoint available to you to have all those points available, and they can help to walk you through the software for your first couple times, just so you get used to where these points are and how to work with them. So again, I'm going to look at the chat room here, and I'll give you a couple moments to be able to. Okay, so Paul, I could go ahead and give you a microphone, and
do you hear me?
Yeah, I can hear you. Please.
Yeah, this is great. I came in late because I was driving, tried to get on the telephone. So I'm glad you've recorded this so I can see what I missed in the beginning.
Certainly.
Is this part of a 3D CBCT system, like a scanner, or is this a standalone software?
So what this is that we're using our images. So HDXWILL is a CBCT manufacturer, and so we have a number of different CBCTs that we use. One of the benefits of having our CBCT is not only the clarity of our images, but that you get the ability to have this software package from Cybermed. So Cybermed is a company that we contract with, and we get their premium package so that we're able to have all these aspects of the software with us. So in this case, being able to have a CBCT and then create the 3D stuff out of there because we have that as part of our package is one of those extra benefits of being able to have an HDXWILL CBCT.
Okay, now if you have another scanner, like we have a couple of them, like Carestream, we have a Dentsply, just different scanners in our practices. Can you get this software, or is it just for a proprietary for your products?
Certainly, I think that the best way to answer that is you probably have to reach out to Cybermed and see if the software is available independently. I don't know exactly for sure. It's not that I'm avoiding the question. It's that I just don't know exactly that they provide it or they don't provide it or what the cost is. So, but Cybermed is the manufacturer of on-demand 3D. And then from that point forward, you can ask them about that. I have a feeling that they probably sell it as a standalone item. But being able to do that as well and be able to look at that. Obviously, with any of these, that the clarity of the images is going to make a difference as far as the overlap is concerned. So especially if you have like an older CBCT, you may not get the same overlap and clarity associated with it. Same thing is also the field of view. Obviously, we need a full face field of view to be able to do cephalometric tracings. That if you can't get these points up in here, that it makes it to where obviously you can't do the full ortho analysis with that as well.
Okay. And then maybe I need to get a demo of what machines you have available, because we're having to upgrade some of them because Carestream is not supporting, some of their machines. So
well, we'd be more than happy to. If you can, we can get your information at the end of the course, or you can send it through chat, and that way I can reach out to you individually. And I'm more than happy to talk to you individually about our CBCTs and our options and what we can do. Okay,
well, that's great. I'll go ahead and I'll type my information in if I can find that little. Do I have to hit chat again to?
Yeah, you just hit chat, and
okay. Wait a minute.
And so I sent you a chat individually.
Okay.
Did you get that? So you should be able to type your message down at the bottom. As long as you give me your information, I'll call you as soon as we get offline here with the WebEx.
Okay, I got it, Tim. I got it. So I'll fill that out. I'm sorry to interrupt you, but keep going. It's great.
No, absolutely. Again, that's part of what we do here is wanting to make sure that we get all the information we can and try to spread it out. This was actually requested by one of our customers. And at first, we thought it was a great idea to be able to reach out and be able to have people to understand more about what they can do with their CBCTs. And one of the things we like to do is be able to make sure that we can give our customers as much information as we can about CBCT and what they can do with their CBCT. It's been one of our things that education is a big foremost thing at HDXWILL. And so it's been something that makes a big difference to us to be able to do that. So.
Great. Is your machine manufactured in the U.S.?
It is a South Korean company. We have warehouses in the United States. We have our North American offices. So again, we can talk more about this offline. But this is something to where, we've basically made it to where we have our items in the United States so that we have the easy accessibility. We have our own engineers to be able to create service. We've done a number of different things to change the way the CBCT market is.
Awesome. Okay, well, keep going. You're doing great.
Oh, well, thank you very much. All right. So at this point, and we've gone through questions. We've kind of taken a look at 3D Ceph analysis. I don't know how much more we can do here. again, with this, our tool options, we can go down and we can also look at 3D analysis and be able to look at those points, and 2D rulers. So again, when we make our measurements, we can do that as well. But again, this gives you a number of different ways to be able to do that. I think when you go into 3D analysis, because it's becoming more and more prevalent, there's more and more literature coming out about that, that what you're going to find is that there's going to be more and more people looking into 3D analysis. So again, Dr. Cho has done probably the most extensive research associated with that. But then you move into where you know, that you're going to find people that have studied rickets and all those other ones are now going to have analogous 3D images to be able to work with to get those same points along the way. But with that in mind, I think that we are through with the 3D Ceph analysis for today. Again, if there's any more questions in chat, I'm more than happy to answer them and be able to you know, answer any other questions associated with it. As I said, always our education team is available, so that again, if there's more questions you don't want to ask online, please feel free to reach out to them. They're more than happy to do a WebEx with you so that they can get you to understand this a little bit further. And again, I might have gone through this too fast or what have you, but we also have it recorded. So if you want to go back and get the recording, this will also help you be able to review that. So at this time, looks like there's nothing else in the chat room. So I'd like to thank everybody for attending today. And we are going to start looking at next Wednesday is we're trying to decide on doing TMJ analysis or if we're going to do 2D Ceph analysis. More than likely, we're going to do TMJ analysis, and then we may work our way into the 2D Ceph analysis. But that way we can at least kind of complete what we've promised in our web series. And again, as we start to progress, we're setting up for being able to have CEs credits being given. We're going to have some doctors involved in being able to talk about actually analyzing CBCT images and ways in which you can do basic analysis of those CBCT images, and some different practices, kind of talking about how they use CBCT in their practice and flows of their practice and how they've chosen to change from just doing two-dimensional images to integrating 3D images into almost every patient care item. So again, things to look forward to, and again, some CEs as well. Otherwise, thank you very much for joining, and everyone have a great day.